Hi, this is Tomas for the Montefiore Medical Center in the Bronx, and I'm going to talk today about the hammer and the dents, and a few questions that you might have about the coronavirus. Just as an introduction, I just wrote a few blog posts that got over 60 million views on the coronavirus, and I've kept writing since then to understand it better and try to spread as much information as there is available and relevant about the coronavirus, so that people like you can take the decisions that need to be taken to fight the coronavirus. So the first question is, how has the hammer the dance been applied in different countries? China, Taiwan, South Korea, Sweden, United Kingdom. In this first graph, we can see how the pandemic has evolved over the last few months in the world. We can see at the very beginning here in China how there was a little blip, but China was able to control it. But a few cases spread out of China, and that's where we get the exponential curve in the rest of the world. At the beginning, measures were not taken, so it was very much like an exponential curve. But as countries around the middle of March or the beginning of March started taking measures, we can see 2 weeks later, these measures really have an impact at the world level with the number of cases slightly slowing down. It hasn't stopped. In fact, we are around quite stable right now in the number of cases per in the world per day, and that's due to some countries going down and some countries going up. In this chart, number 4, we can see how different countries are moving in the hammer and the dance. So first, what is the hammer and the dance? It is this strategy where if the virus comes to you and you're not prepared and you have an explosion of cases, you don't know what to do, just stop everything. Stop the economy, everybody stays home, so the case load can go down and we can prepare for the dance. The next step, we can prepare the measures that we're going to have to slowly reopen the economy while maintaining the case load low, because now we replace these heavy measures of the lockdown with intelligent measures to reduce the spread of the coronavirus. Countries like Canada, France, Germany, Spain going down little by little from that peak, and many of them, such as Australia, already out of that peak and ready to dance. In the case of Germany, for example, they opened up the country a couple of days ago and they had an outbreak, so now they're going to tense it again. So they're not quite out of the hammer, but you have countries like China and South Korea that have been able to get out of the hammer and are dancing pretty successfully right now. You have a couple of countries, Japan and Singapore, that had been dancing for a long time and had an outbreak, and they had to increase the measures against the coronavirus right now, the lockdowns. And you have countries like, or a territory like Hong Kong and a country like Taiwan that have been dancing since the beginning without major outbreaks. Compare that to most of the countries here in the rest of the world, especially Europe and America, but also countries like India. So most of the world is in this hammer period. And then you have other countries here like Russia, Belarus, Mexico, that the cases are still just growing. Whereas there's countries like Sweden and maybe even Netherlands that have an approach that's not quite the hammer and the dance. They're actually opening these up and saying, you know what, let's go for herd immunity, or let's not close the economy too much. It's going to be too bad for the economy. Let's keep the economy pretty open, and we'll assume that this is more like a flu, and hopefully it's not going to be too bad for the economy or the health. In this graph number 3, we can see the evolution of the cases in different countries. So you can see here at the top, you see a lot of green and then some red. That means that for that country, the peaks of cases are in the red area, means that these countries are suffering the worst of the epidemic right now. And this, by the way, is updated as of mid of April, so it's nearly a month old. But you can see at the bottom that there's a lot of countries that had green and then red, and now we're back to green, which means that they passed the peak and then they're back at levels of very low cases per day. Countries like Switzerland, Luxembourg, Iceland, Norway, Austria, Australia, all of these are now in this position, which shows that many countries have been able to apply the hammer successfully, and now they're out of that. They passed the peak and ready to dance. Here in this chart, we can see how many of these countries can be compared. The graphs that have a green background are the countries that have been able to apply the hammer successfully and are ready to dance. So you can see countries like Austria, Australia, South Korea, Spain, Belgium, Slovenia, New Zealand, Germany, Portugal, Turkey, Iceland, Ireland, France, Czech Republic, Switzerland, and so on and so forth. All these countries had this peak in red and then are now going down. The black line that you can see is the mobility. The higher that line, it means the more stringent the mobility reduction was. So a high line means, hey, we really stopped a lot of the economy. And you can see that a lot of these countries that were successful had a very high black line, and that is correlated with the area, the time around which the cases, the red line, went down. You can see then countries in blue, in orange, or red. Those are the ones that have not been as successful. And so you can see that in the red area, for example, many of these countries were not very aggressive with their measures. An example is Russia. Russia has not been very aggressive, and you can see that in the caseload, which is exploding. Egypt was not very aggressive. Ukraine was not very aggressive. You do have some countries like India, for example, or Peru or Argentina, which were quite aggressive and were still not able to control the epidemic. You also have countries like the UK or the US, which had a reduction of mobility, but it was not very aggressive. And the result is that the caseload is actually now stable, is not going up or down. Now let's focus on East Asia on chart 5, because East Asia is very special. They had experience from SARS, they had experience from MERS, they understand how to manage epidemics at scale in a developed economy, and knowing what they know is very relevant for us. So we can see here that China and South Korea had the earliest outbreaks, as we know, and they went down. And you can see that for China and for South Korea, these caseloads have been still quite low. You have countries like Taiwan and Hong Kong, which never really had an outbreak, and Japan and Singapore, which had an outbreak around the middle of April. In both cases now, these outbreaks have been quite controlled, but we can learn a lot from what China did, what South Korea did, the reasons why Japan and Singapore had an outbreak, and what they're doing against that outbreak. So first for China, you might have seen this graph in the past. The orange here is the number of cases the way you know them, right? And so at the peak, they had around 3,000, close to 4,000 official cases registered. This is when and around January 23rd, this is when they had the lockdown. And you can see that even after the lockdown, around 2 weeks passed until the number of official cases went down. Now, this gray curve is interesting. What they did is they asked all these orange people here, these people that were cases, when did your symptoms start? And then they dated that, which means that this curve is the curve of the onset of symptoms. And you can see that a day after the lockdown was ordered, suddenly the exponential curve is already slowing down. And the peak is around 2 to 3 days after, which is probably due to the fact that it takes 2 to 3 days for all the symptoms to really appear, to start really appearing with this virus. But what you can see is that immediately after the lockdown was ordered, the number of cases or infected people that had symptoms started going down. Here we can see a full graph of Wuhan and the number of cases that had per day, and you can see that you have this major outbreak, but it starts in January 23rd, and by around March 15th or so less than 2 months later, around 9 weeks later, it was completely controlled. So you can, if China could do this, obviously other countries could do it too. This is South Korea, and South Korea had a first outbreak. They're having a second outbreak right now in the middle of May, but they had an outbreak in February. It was one of the first countries after China to have it. And it was due to this patient number 31 that visits a mega church twice in 2 Sundays in a row. And that creates a massive spread. The time between these explosion, this outbreak starts, which is around February 20th. And the time when it is controlled, around March 3rd, is around 3 weeks. So 3 weeks to stop that outbreak, and they did not close the economy. There was no lockdown. That's one of the things that people don't know really well. They did not stop the entire economy. What they did was focus on the city that had the outbreak, in this case Daegu, and they heavily recommended people to not go on the street, not open their businesses. They did close some businesses, some schools, but overall it was more an advice for people not to leave, except that the population already knew from MERS what they had to do. So nobody wanted to go on the street. They knew already what they had to do. Everybody who went on the streets already started wearing masks. And so that is how you control an epidemic like this intelligently, only in 3 weeks. Here you can see a comparison of mobility in South Korea versus Spain. And you can see that in retail and recreation, it went down mobility by 17% compared to Spain, which is 94%. You have transit stations minus 14% compared to nearly 90% in Spain. Workplaces minus 13% compared to minus 70% in Spain. So that shows how much of the economy in South Korea was not impacted compared to a country in Western Europe like Spain. And one of the things that they did was contact tracing. If you think about it, the hammer is really these huge measure to stop the virus completely, stop the spread, because you don't know where the cases are, so you need to stop everybody. A more intelligent way to do it is to identify where are the cases and then isolating those. And that's what South Korea does. As soon as somebody is infected, and they know because they're testing a lot of people, they talk with this person, they look at this person's information, and they trace all their contacts, and all their contacts go into quarantine. So as a result, instead of quarantining the entire economy, you can just quarantine a few people. And here in this graph, in this map, they show the points which are in Seoul where there's been cases recently. So that if you were in one of these areas, you can say, oh, I was there, maybe I should quarantine, or maybe I should get tested. Singapore is an interesting case because for months and months, up to the end of March, they were getting cases, but no outbreaks was happening. And so what did they do? They do a lot of things well, but there's a few things that they didn't do that hint at what we need to do. So with the first one in this graph, you can see that this is the outbreak, the cases per day, and the pink are local cases, the blue are imported cases, seeds, which they call. You can see here at the end of January that China was exporting cases into Singapore. And then Singapore banned Chinese visitors at the end of January, and you can see these blue cases stop completely. Then you have a little bit of community spread, a little bit. And then around the beginning of March, they bans visitors from Iran, South Korea, and northern Italy, which also reduces cases from there. It prevents any seeding from these countries. But what it doesn't do is ban tourism or visitors from other places. And that's the major problem, because around the beginning of March, you have an explosion of cases around the world. And until March 17th, they don't close borders with Italy, France, Spain, and Germany. And it takes them a full week more until around March 25th to ban visitors from everywhere. Now, the problem is at that point, Bangladesh, Indonesia, the UK, the US had major outbreaks, and they were importing a lot of cases into Singapore. Finally, they closed the borders around that time, and you can see immediately the number of blue cases going down. But that was too late because at that point there was an outbreak because these seeds had spread locally. Another case that's interesting is the case of Sweden. Here you can see the 4 Scandinavian countries: Sweden, Denmark, Finland, and Norway. When you compare different countries, you want to pick the right countries to compare. For example, the US has nothing to do with India, and so it makes no sense to compare them. But the US might be more similar to the UK or Canada or Spain or France, and so those are relevant comparisons. In the case of Sweden, it has very natural comparisons, which are the other Scandinavian countries: Denmark, Finland, and Norway. So when you compare, you want to assess what Sweden did and what worked and what didn't, you want to pick the closest country to Sweden. They had the approach of saying, this is not very bad, this is very much like a flu, and so we should just let it run. Some people are going to die, but our economy is going to stay afloat, and that's going to be better for the country overall. And it might well be that we can't even stop the spread of the virus, so we should rather get this quickly and get the economy back up again. This is why you can see the cases in Denmark, Finland, and Norway, which were following a hammer and the dance. In all 3 countries, the case is going down from their peak. But in the case of Sweden, the exponential growth stops here, but after that, the caseload continued growing. This is the fatality rate per million inhabitants in Scandinavia. So out of 1 million inhabitants, how many die from coronavirus? And what you can see is that the fatalities in Sweden are 3 to 7 times more than in other Scandinavian countries, 3 times more than Denmark, and 7 times more than Norway and Finland. So really, a lot of people are dying in Sweden. One of the questions that we have is, what do we know about the potential economic impact of the coronavirus and the different strategies? Should we follow a herd immunity strategy? Should we follow a hammer and the dance strategy? Some people think that leaving the country open means that the business is going to continue the way it used to be. But that's not the case. Here we can see Sweden compared to Denmark, Norway, and Finland, the other Scandinavian countries. And you can see that around March 12th, the mobility in all 4 countries goes down dramatically. This is before many of them had applied some measures. In Sweden, the mobility goes down by around 20%. In Denmark, Norway, and Finland by around 30% at this point. That means that Sweden had 2/3 of the mobility reduction from the rest of Scandinavian countries. So it's not like their economy is completely open and everything is business as usual. Not at all. They didn't apply a hammer. They didn't close the economy, but people are staying home and they're not consuming regardless. And we don't know what the impact in the economy will be in the long term, but we can make some guesses. The market is a good place to know what people are guessing for the future. So in this chart, we can see in red how the markets have evolved since the middle of February for Denmark, Norway, and Finland, and in blue how they've evolved for Sweden. And you can see that since middle of February, Denmark is down, the index in Denmark is down by 6%, Norway is 16%, Sweden was 17%, and Finland 20%. Which means that the market believes the Swedish economy is not going to do better than Denmark or Norway or Finland. They're broadly the same, maybe actually even worse. So they are having 7 times the fatality rate and about the same economic result. That might be counterintuitive, but why is this? It's because of the mobility we were talking about. If a virus is running around and is killing people, people don't want to go out. They want to stay home and they don't want to consume. They don't want to get infected. That means that the economy also crashes even if you don't order a lockdown. That's one of the key reasons why the hammer and the dance is not only a better solution for the health and life of people, but also a better economic solution. Because if people are confident that this is contained, they can more freely go out and consume. This is speculation, but has there been a moment in time in history when we have seen that happening? Fortunately, there is. In 1918, there was this pandemic that you probably know, the 1918 flu. And in the US, there's actually really good data on how different cities behaved. Some cities took a longer time to take measures and took measures for less time, and they were less aggressive. Some were much more aggressive for a longer period of time. The question becomes, how did different cities react to this, and what was the consequence for the fatalities and for the economy? If people that defend the herd immunity strategy were right, what you would assume is that the more people die, the better the economy was a year later. So you would see these different red dots here in this area of higher mortality and more economic growth, and these green dots here, which are the ones for the cities that took stronger measures for a longer period of time, they would have less mortality, but also a weaker economy a year later. Is that what we see? We see the opposite. The more people died in city, the weaker the economy was the year after. In this case, the measure is the change in employment between 1914 and 1919, and you can see that the cities that had the strongest economy were also the cities that had the fewer deaths. This is, by the way, controlling for many other factors such as percentage of agricultural economy and things like that. So it's very much focused on just the mortality, like the impact of the flu. And this is not just for employment. Here we can see growth in manufacturing employment, manufacturing value, banking assets, compared to the number of days that the measures lasted. And you can see that the more days measure lasted, for all these indicators, they were up. The economy was doing better. The same thing is true for how fast measures were enacted. Not just how long, but how fast, how quickly since the beginning of the outbreak. And you can see again that the cities that had the earliest measures were the ones that had the best growth the year after. What can we learn by examining the rates of positive tests in different areas? Everybody talks about testing, about the hundreds of thousands or millions of tests that people are making in their country. But the question is, how many tests is the right amount of tests? Here we can compare the share of positive coronavirus tests in different countries. So this measure is what percentage of the tests you make turn out positive. In the case of Brazil, 60% of the tests were positive. And you can see here UK, US, and all these other countries were between 10 and 20%. You can see at the bottom the countries that have been able to control these really well, such as Hong Kong, Vietnam, or Taiwan, or Australia. They have around 0 to 3% of their tests that turn out positive. So the countries that are able to control the epidemic have around 3% of their tests turn out positive. The countries that are suffering have between 10, 20%, or even more percentage of their tests that turn out positive. So what's happening? Well, what's happening is the countries that have, say, 20% of positives, they only testing the people who are coming to them with symptoms. If you have symptoms, I need to know how to treat you and whether I should quarantine you or not. So I test you only, and then there's 20% of these people who turn out to be positive. In countries like Taiwan or Vietnam, or cities like Hong Kong, that's not how they do it. If they find somebody's infected, they trace all their contacts and they're going to test them too. So you have many more tests, not only on people who have symptoms, but also on other people who don't. And that's how you end up with a positivity rate of around 0 to 3%. So that should be the goal for our countries if we want to have intelligent measures to lift the lockdown. If we want to lift the hammer and dance, we need to be intelligent. We need to have testing and contact tracing work really well. And the only way we can do that is by testing a lot. And if 20% of our tests are turning out positive, we're definitely not there yet. For you to go from 20% to around 3%, if your caseload doesn't go down, you need to multiply by around 5 your number of tests. This is a graph for by the end of March of the positivity ratio for different US states. And you can see many states had very, very high positivity ratios, whereas some states here at the bottom that were not very impacted, such as Alaska, had very few tests that are positive. So the US really, in many ways, can be seen as different countries in the way that each state has behaved. Here we can see in this graph what happened in South Korea. The red line is the number of cases, the new cases per day. The green line here is the number of tests per day, but times 33. You can see here the top of the line of the axis here is 30,000. The top of the axis for cases is 900. Why have I done it this way? Because that way, when these two lines cross, you get 3% positivity. And if the green is above the red, it means that you are below that threshold. If the red is above the green, it means that your positivity is higher than 3%, so it's bad. You can see here that South Korea at the beginning had a few tests, and then suddenly the caseload explodes. They immediately, quickly increase the number of tests, but that was not enough. But thankfully, thanks to that exercise, they were able to crush that curve. And a few days later, they are back to having more tests than they needed for the 3% threshold. How does that compare with other countries? Well, this is Italy. You can see the huge curve going up to 6,000 cases and then going slightly down. And the number of tests that they apply daily has been going up little by little, but at the middle of April, they were not there yet. They didn't have enough tests to reach the 3% positive rate. And that's true for Canada, UK, Japan. All these countries did not have enough tests in the middle of April to cover all the population and get to a ratio of 3%. Conversely, a country like Taiwan, which has done an amazing job at controlling the coronavirus, had way more tests than they needed compared to the number of cases they had. Is this like the flu? Because if it's like the flu, then we should let it run. If it's worse than the flu, we should not. Obviously, you guys have a very good insight into that because you are seeing the people flooding your healthcare centers, and you are seeing that the symptoms are quite unlike the flu. But not everybody is seeing this. So is this like the flu? First, let's look at the case fatality rate for South Korea. This is the red line here. This is the percentage of the cases, the official cases, that end up dying. You can see that that line keeps going up, and it converges towards around 2.5%. So 2.5% of the official cases end up dying. This line, the blue line, is the percent of tests that are positive. You would imagine that the more tests South Korea applies, the more people turn out to be identified, and as a result, you get closer to the fatality, the true fatality rate, not only the fatality rate of official cases, but that rate of official fatalities is not going down. With more tests, it's just moving closer to between 2 and 2.5%. And we can see that in most of the countries that have already left behind them the big outbreaks. You can see South Korea is between 2.5%, Denmark is around 5%, it is converging in that direction, Norway is around 2.5 to 3%, Thailand is between 1.5 and 2%. And with more tests, as this positivity rate is going down close to 3%, with more tests, that case fatality rate is not going down. We also have data from, for example, the Diamond Princess cruise that puts the fatality rate around 1.5%, and that's actually a pretty good test because you have contained, you know exactly how many people there were, you know what percentage of them turned out to be positive, and so you know exactly what happened there. And even there, the case fatality rate was 1.5%. How does that compare to the flu? So here we can compare the fatality rate, the case fatality rate of the flu and the coronavirus per age. You can see that for the blue, which is the flu, the fatality rate is very close to zero for most of the ages. And for 65 plus, it's around 1%. Compare that to the coronavirus, which is also has a similar curve, except that it's much higher at every age range. And so even people who are 5 to 17 years old, a few of them die, 0.1%, and it goes up and up and up. For 50 to 64, it's around 2%. And above 65 years old, it is close to 8%. And that does not account for unrecorded deaths, collateral damage, and chronic conditions. And we can look at the infected fatality rate for that. Here you can see that a bunch of different seroprevalence tests that have been done and what that suggests in terms of the infected fatality rate, right? So we look at the entire population, we make a sample, we determine how many people were actually infected, we compare that to number of deaths, and then we make a ratio. So looking at the biggest tests around the world and then the ones that have the fewest methodological issues, you can see that there's different infected fatality rates, which makes sense. There's different tests, none of them are perfect, and they're also testing different populations in different places. But what you can see is that broadly the infected fatality rate is around 0.8%, which means that close to 1% of the people who get infected by the coronavirus die. In the US, if say 2/3 of people catch this, that's around say 220 million people. If around 1% of these people die, you get around 2 million people dying in the United States. And that's only accounting for the official deaths, because a lot of people are dying and we don't even know that it was due to the coronavirus. And this graph shows the deaths that are measured in the country independently from coronavirus. And you can see that here the blue lines are the normal mortality rate in other years. And the red line here is the mortality rate this year. And you can see that the mortality rate has been exploding in many of these countries since the coronavirus started coming. Based on an analysis from France, Spain, and Italy, around 2 to 3 times more deaths have happened than was officially counted as due to the coronavirus. What do we know about how and when the coronavirus is transmitted? This is an image of all the people who were infected by the super spreader in South Korea, patient number 31. Around 5,000 people were infected there. That was, at that time, more than 60% of the cases in the country. What you might not know is what the megachurch looked like, where she went and infected all these other people. So this is what an event in that megachurch looks like. You have a lot of people very close to each other. They were not allowed to wear masks or glasses, and they spend a very long time close to each other, singing, praying. These are the cases in Singapore. These are all the cases in Singapore and how they're connected to each other. You can see that there's a lot of these clusters here, and the ones in blue are worker dormitories. These are dormitories for foreign workers that go to work in Singapore. You can see that many of these outbreaks were linked to some of these dorms. So what does a dorm like that look like? This is an image of an area around the dorm like this a few days after a ban on social gatherings was enacted in Singapore. You can see that many of them are wearing masks, but not all. And there's a lot of people very close to each other. This is what their living conditions are like. So it's very, very high to stay apart when 6 people are living together in the same bedroom. But you can see here that this spread is linked, again, to a lot of people confined very close to each other. This is an outbreak that happened in Germany, in the ski resort of Ischgl. And you can see this bar where a lot of, this is representative of an upper ski bar in that city where there was an outbreak. Again, you can see here a lot of people confined in a crowded place, very close to each other, talking, singing, and touching each other. This is an image of another festival in Gangelt in Germany, where also there was an outbreak in Germany. Again, you can see people close to each other, a lot of them singing, dancing, touching each other. There's been around 100 outbreaks in meat packing plants in the United States. And they have touched over 5,000, they've infected over 5,000 people. And you can see here that all these people are working together, close to each other. In this case, many of them without masks in a confined environment for hours. This is an image of in a restaurant in China, where you can see here all these tables in the restaurants, but only people in a few tables, A, B, and C, were infected. If you look at all the people in these tables, A1, this case on table A, was the first one to show symptoms. This person had symptoms, I think, that day at that restaurant. You can see that a few days later, all the people in red developed symptoms. And so what you can see is, again, this is a restaurant. They overlapped for at least 1 hour. So it's a confined environment where people are talking to each other, close to each other, face to face, for a long period of time. And the distance here is a few meters. So it's not only the people who are super close, but also the people who are a bit farther away who got infected. This is a call center in South Korea. And the blue people are all the people who ended up infected. And you can see that more than 40%, I think 45% of the people in this floor got infected. You can see obviously that there's a lot of distance between these people, but it's not like one person infected them all. It's that over a few days or weeks, the virus little by little spread from person to person and ended up infecting all these people who, again, because this is a call center, are together confined in a closed environment for hours talking. These people here at the bottom, they were not as in contact with the people at the top, and as a result, they were not as infected. These people shared elevators and common rooms with other people, but most of the other people were not infected. The infections really mostly happened here, which is, again, a confined environment with a lot of people who are talking a lot. A person spewing some aerosols. And here, look at what's forming here. It's a cloud. Some of these drops just fall directly, but many of these stay in these clouds that keeps the droplets floating for a few seconds or minutes, in some of the cases hours. And you can see how a cough like this actually travels over up to 8 meters for a bunch of seconds and doesn't even disappear. Here you can see this video.
Stay healthy.
You can see
Stay healthy.
these green dots.
Stay healthy.
This is just talking. And now you put a mask like this one.
Stay healthy.
No green dots.
Louder. Stay healthy. Louder. Stay healthy.
Even screaming, now suddenly you don't have droplets. And this shows the air movement for a person that is just breathing, talking, and in this case, coughing. And you can see what this does with a mask or without a mask. So that shows the importance of wearing masks. Obviously for people to be protected, but even more importantly, for the people who are sick to not infect other people.
I've always thought if we could somehow just see the germs around us, everyone would... Teacher had been secretly infected with the glowing powder. So she randomly shook the hands of 3 kids, but didn't touch any of the rest. And so with that, they just went about their normal day. At break, I did choose one random student, and he agreed to letting me put some of the powder on his hands too. And then 2 hours later at lunchtime, I checked the results. Remember, everything you see here started with just the teacher and one student having a little of that powder on their hands. And because my flashlight can only illuminate one spot at a time, I used Photoshop to better visualize our observations of where germs were left behind, including on the other kids.
So this video shows the fomite spread of the coronavirus. A lot of spread could happen through surfaces. The question is how much. This graph here shows the spread of the coronavirus through different ways in different days since the onset of symptoms, or since infection. So you can see here on day 0 the person is infected. 2 weeks later that most of the people are not infected or infectious anymore. And you can see this is the curve of infections. You can see this is the number of infections per day. The mode, the maximum number of infections per day happens around day 5. And what you can see is that a big chunk of the infections come from symptomatic people, but an even bigger chunk of them comes from pre-symptomatic people, 45%. Infections from environmental and asymptomatic people are believed to be really, really low, 5-10%. And so it is important, especially environment is 10%, so you want to reduce these, but really these two don't matter much compared to the symptomatic and pre-symptomatic infections. These also highlights a very important lesson, which is it is very important to catch people who are symptomatic as soon as possible. Because if you catch them very, very soon, you can then reduce the percentage of infections, right? This area here, if you only catch people on day 5, they've had created all this area of infection, and you're only eliminating this area of infection. But even if you do an amazingly good job at testing people who have symptoms, you're only going to reduce these 40% of infections. You also need to eliminate these pre-symptomatic infections, which are close to half of infections, right? So 45% of infections are from pre-symptomatic. We absolutely need to catch these people before they infect other people. The only way we can do that is with contact tracing. Once we know somebody that has symptoms, we want to trace all their contacts and we want to test them all to make sure that they are not infected. We want to quarantine them all, and the ones who are infected, we want to isolate them. And that way, we can be intelligent about identifying and isolating only people who are sick and letting the rest of the people run the economy. Another thing that's interesting is kids. What do we know about kids and the spread of the coronavirus with kids? So this graph shows on the bottom, the x-axis, the age of the person that infects, and here on the vertical axis, the age of the person that suffers the infection. And you can see that most of the time, the people who infect other people are adults here, right? Adults infect adults, and the older they are, usually it starts around 45-ish, all the way to 100, and this is where most of the infections happen. Interestingly, kids barely infect anybody else. And also, kids don't tend to get infected. The most they get infected is around here, mostly probably through their parents or their grandparents. So there's a little bit of infection, but very little. And they don't infect much. This is what we know so far. If this is true, it means that schools are among the safest things to open. How important is the widespread use of face masks in public for reducing the viral transmission? At the end of April, around 25% of the countries in the world were already mandating nationally some sort of mask wearing, whether it's in public transport or all public life. And we can see why. Here in this graph, you have in the horizontal axis particles of different sizes, and the number is proportional to basically how many of these particles go through the mask. And you can see that well, if there's no mask, a lot of these in red, a lot of these particles end up being captured and forming a colony in this case. Having a surgical mask here in dark blue reduced substantially the transmission. But in light blue, these are homemade masks. And you can see that in fact, they reduce a lot of these particles. They catch a lot of these particles. Interestingly, the many different fabrics are very useful for this. Silk, linen, cotton, pillowcase, many of these are pretty good. So what's a good mask? A good mask is a mask that has probably a couple of layers of different materials, materials that are relatively dense, and is properly fit to the face. And what can be the impact of a lot of people in society wearing masks? Here in this graph, you can see how good a mask is. What percentage of all particles does it filter? And here, what percentage of these people are wearing such a mask? If 60% of people are wearing masks that catch around 60% of particles, we get in this blue area beyond this point. What is this point? This point is the effective reproductive number, the transmission rate. And we want the transmission rate to be below 1 because that means that this virus is not spreading anymore. So what this is saying is that if 60% of people wear masks that are 60% efficient, we can just with this measure potentially stop the coronavirus epidemic. Now, this is obviously a theoretical model, it's not perfect, so we need to be cautious and we cannot rely on this. But this says how important wearing masks is. It is crucial. And we can see that in cities like Hong Kong or countries like Taiwan or South Korea, one of the core measures is that mask wearing is nearly universal. And these countries that have so many masks have been able to keep their normal lives mostly without too much economic impact, among other things because they are wearing masks. How important is hand washing and how should we wash our hands? This is a small video that shows how and why we should be washing our hands. You can see with the normal washing, there's a lot of areas that are not washed. So you also need to wash the back of the hands and in between the fingers. You can see the tips here are still not washed. So you also need to be washing this way. And you still have your thumbs that are not well washed. So you want to do this with both of your thumbs. And then you still have here the arms. So you need to wash some of it. And there you go. Now you have soap everywhere in your hands and you're good. Not only that, but also you need around 20 seconds for the soap to really have an effect and break the viruses. So the combination of really covering everything plus waiting for that soap to really have an effect is why you should be washing your hands for 20 seconds. What is the role of contact tracing in quarantine in containing the COVID pandemic? Testing and contact tracing are the intelligence, and isolations and quarantines are the action. In testing, you identify all the people who are infected. For contact tracing, you look at all their contacts to see which ones are infected. As soon as you know somebody is infected, you isolate this person. And for the rest of the people who might, but you're not sure, you quarantine them. And what this does is, instead of quarantining the entire country, you can just limit the isolation and quarantines to the people who are infected. And that might be 0.001% of the population, and the 99.9% of the rest of the people can keep the economy up. And that is why testing and contact tracing is so important with the isolations and quarantines. You do these four things well, you're able to identify the people who are sick and the people who might be sick, and you only quarantine them. What percentage of contacts need to be traced and quarantined, and how important is the speed of contact tracing? Here we have a graph of different viruses, let's say, with different reproduction numbers. So here this is equivalent to the R0, right? So let's assume that for an R0 close to 3, how many contacts need to be traced and then isolated or quarantined to get the epidemic below 1. And you can see that the more contacts you trace here and then isolate and quarantine, the more the transmission rate goes down, all the way to below 1, which is what you want. Now, these, which is R naught of around 3, which is close to what we have, our best guess right now is 2.7. To get the transmission rate below 1, you need the share of contacts. You need between 80 and 100% of their contacts to be traced. What this is saying is you need to trace a lot of contacts for you to really have a strong impact through contact tracing in the epidemic. This graph shows the percentage of cases that are isolated on the horizontal axis, and on the vertical axis, the percentage of contacts that are successfully quarantined. This black line here is the separation between not controlling the epidemic and controlling the epidemic. What this is saying is if you're able to successfully isolate 60% of the cases and around 50% of their contacts, you can get above this line of 1 and you get into an area where you've controlled the epidemic. This is how important testing and contact tracing, isolations and quarantines are. If you're able to get 80% of infections and 80% of their contacts, then you get in this very green area and you're very, very confident that you don't have an epidemic. Even if you do a little bit, it matters, right? If you only do 40% of cases and 40% of their contacts, you're still getting closer to this line and you're reducing the epidemic substantially, so it's still useful. But this is showing how important and valuable it is to test and isolate and trace contacts and quarantine people. This assumes that the testing and contact tracing is immediate. But as we've seen before, immediate means that you catch people very, very early on, right? But if you take 2-3 days until you catch these people, then all of these infections will have happened. So what is the impact of time? This is instantaneous, and it's this graph. If instead of doing it instantaneously, it takes you 1 day, you can see that this black curve now has shifted up. And then 2 days it shifts up again, and then 3 days shifts up again. So now if it takes you 1 day to trace all contacts, you need to isolate maybe 60% of the cases and close to 70-80% of the contacts. If it takes you 3 days to isolate contacts and isolate cases and quarantine contacts, now you need basically 100% of 100% of cases isolated and 100% of contacts quarantined in order to stop the epidemic. This illustrates how important it is to test and trace contacts, but also doing that very, very fast. If it takes you 3 days to do it, it's really not as helpful compared to doing that very, very fast. Is manual contact tracing sufficient? How many tracers would be required? Many plans talk about having a number of contact tracers per 100,000 inhabitants. And really, I don't think it makes a lot of sense, because if you have a massive outbreak and you compare that to a country that has no cases, both have 100,000 people, do you need the same number of contact tracers in both? No. The number of contact tracers you need is proportional to the number of cases you have. And so imagine in the US, in May 13th, we had around 22,000 new cases. So far, we believe in the US you need around 15 contact tracers per case. That together means 300,000 contact tracers in the US. They are the bread and butter. They are the ones who have the core impact on the virus. But you could imagine also having better processes, better education, better technology, better data, And if instead of 15 contact tracers per case, you only needed 5 contact tracers per case, which is probably around what Wuhan had, you only need 100,000 contact tracers in the United States. And this is what illustrates what a contact tracer does. Here you have Bob, who's infected, this red dot, and he has his family around here, and you want to identify all of these contacts. The family, obviously, but also the coworkers and the friends and people who share the same bus and people who are in the same grocery store. And you want to identify all these people with whom he shared a confined environment for some period of time to test them and put them in quarantine. Now, Bob is imperfect. He doesn't know, he doesn't remember what bus he took, or he might not remember a dinner that he had with friends. So in a conversation with an investigator, the investigator is only going to be able to tell the family members for sure, some of the coworkers with whom Bob worked, and maybe a group of friends with whom Bob remembers he had dinner, and maybe he remembers also that he was at the grocery store, and so the 2 people working at the grocery store can be traced. This is what you can do with an investigator. This, however, is really good because around 80% of infections happen in the household or with close friends. And so you get really the 80-20 just by doing this manually. How helpful would it be to have access to electronic data? GPS, credit cards, CCTVs. So this is what you can do manually, all the contacts you can trace manually. But this is what you can do if instead of doing this manually, you can also use data from the infected. So in South Korea, what they do is if you're infected, they have access to your GPS data from your mobile carrier company, and also your credit card information to know where you spend money. They also have access to CCTVs to know who was there. So how does it work? You get infected, an investigator looks at your case, looks at your mobility, and from that, they can have a conversation with you and say, oh, okay, on May 2nd, you were at the grocery store. Does that ring a bell? Yeah, okay, all right. Now they can go and look at the CCTV to see who else was there, see what the movements were, and see with whom this person talked. And then they can go and reach out to these other contacts to tell them, hey, you talked with a person that was infected, you might want to get tested. This is how getting information about the infected person is so crucial. It can help trace a lot of contacts. Can smartphone apps or QR codes be useful tools, and under what conditions? So this is what the contact tracing looks like with a manual investigator plus access to personal data from the infected. And let's assume that all these people in blue here have a Bluetooth app. Let's assume that in the best of cases, 30% of people download that app. So in 70% of the cases, your infected person will not even have the app, so it's worthless. For the remaining 30%, only 30% of this person's contacts will have an app. So that means that only 30% times 30%, meaning 9% of the contacts will have the app too. But also, they might not have Bluetooth enabled at the same time. And so in fact, a smaller percentage of contacts is actually going to be traced. Overall, if you look at all the ways you can lose people, a normal contact tracing app is only going to give you around 1% of the contacts traced. There are ways you can increase this, but the only way is to really mandate a lot of people to be using these apps, or making it really, really, really easy or obvious for a lot of people to have these apps. Iceland has 40% penetration of these apps, and they still say they're barely useless. They're mostly useless. For them to be useful, you would need around 80% to 90% of the population to be using these apps. That's going to be really hard unless Apple or Google make it mandatory, or governments. Another way to do it is if you just force in your area people to have an app like this. And you don't even need to have an app like this. You can just have a QR code. So how would this work? Imagine that to go to the hospital, or to go to the grocery store, or to go to your office, each time you're forced to have an app or you scan a QR code. At that point, the company knows exactly all the people who were at a given time in the building. And if one of them ends up being infected, you can look at all the people who are in the building around the same time, and you can go and trace all these people. The only way this is useful is if a lot of people in the same community do it. So if QR codes or mobile apps were mandated in some communities, it would have a potentially very high impact in the ability to trace contacts. What authority is needed to isolate infected patients and to quarantine asymptomatic contacts? One of the things that people don't remember is that in the past, infectious diseases were really bad. This graph here shows the mortality rate in New York since the beginning of the 1800s per year. And you can see that in all of the 19th century, you have a lot of spikes, and in the 20th century, you have nothing. It is much lower and it is much stabler. Before that, you had a lot of spikes. Smallpox, 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 cholera, cholera, cholera. So every few years, these infectious diseases came back to infect you. This was so bad that so many people died that people before us, our ancestors, knew that if you were infected, you had very different rights than if you weren't. If you're infected, you're a danger to the rest of the population and you need to be isolated. And as a result, the rights of people who are infected are different from the rights of people who are not. So in the question of what authority is needed to isolate infected patients, there's this concept of notifiable diseases. It's a concept that has been around for centuries. If you have a notifiable disease, the authorities have to know about it. And they have to know about it because you're a danger for others and you need to be isolated, even if you don't want to. It would be relatively easy to qualify the coronavirus as a notifiable disease, and immediately it gives the government an authority and an ability to deal with these patients. Their privacy rights are different, and their rights to be free are also different because they are danger to other people. How much privacy do we need to sacrifice to do effective contact tracing? This is a graph built over 18 months of data accessed about a person that didn't know about this. So this is the New York Times who did this research, and they looked at a person who was willing to work with them and say, okay, figure out all my data. And they went on to buy data for this person, about this person, and they were able to trace all of their life back. They knew where this person shopped, where she went, for how long. And you can track so much of people's lives based on data that is already available publicly and purchasable. That's the first side. We already have all our information that's available. Not only that, but in this case, we have a trade-off to make between privacy, life, and the economy. We've already given up a lot of life and health. We've already given up a lot of economy. If we can give up a little bit of privacy to get a lot of economy and life back, is it worthwhile? It's worth exploring. And really, the privacy that you give away is not that much. First, it's the privacy of the infected person. That person, because the coronavirus should be a notifiable disease, should have a different level of privacy. And once their disease is notified, investigators should have access to this person's data to know where this person has been. This is the way it works in South Korea. There are ways, however, to do that very intelligently. In the case of South Korea, this data is not accessible for the rest of the government. It's only for the Ministry of Health. Only 3 weeks of data are available. That data is not available to the government all the time. It is fetched only when a person is infected or one of their contacts is identified. And then after that, it is deleted. So with a very narrow reduction in privacy for only a few people, only for a certain amount of time, and only accessible to a few people, you can have a dramatic impact in the epidemic by tracing the contacts. Based on all of this, what are the essential elements for a strategy to contain the coronavirus in the US so the hammer can be safely lifted? Again, if we think about this, the hammer is this very heavy measure where we're saying we don't know where the cases are, so everybody stop and stay at home. For you to be able to lift the hammer, you need to be able to identify the people who are sick and only isolate those. You're changing the hammer with a scalpel. And so what are these measures? We said it. Testing to identify the sick people. Contact tracing to identify their contacts. Isolations for the people who are sick, and quarantines for the people who might be sick. This is the bread and butter, and this is the way to be intelligent about who you quarantine and isolate. Aside from that, you want masks, and until you have surgical masks for everybody, homemade masks are pretty good. Everybody should be wearing masks because you don't know who's sick and who isn't. You might be spreading these being asymptomatic, pre-symptomatic, so everybody should be wearing masks, because the most important is not for the people who receive the infection, but for the people who might be spreading the infection to be wearing a mask. You want hygiene, of course, washing your hands. You need physical distancing too. You want to be farther apart from 6 feet from other people. You don't want to talk face to face with other people. You don't want to sing close to other people. You don't want to be in a confined environment with other people, especially for long periods of time. And then you want public education about all these things, especially hygiene, physical distancing, and homemade masks. These are the cheap measures that everybody should be doing. There are also probably some expensive measures that are needed. One of them is travel restrictions. If you do an amazing job at eliminating an outbreak inside of your state or city or country, and then you get people coming from another country that are seeding new outbreaks, that's really bad. That's what happened to Singapore. So you need travel restrictions to avoid this. And you also avoid social gatherings. As we saw before, there's a lot of outbreaks that happen in big super spreader events, and you want to avoid that. So you want to have limits to social gatherings, which entails a lot of measures for businesses. For example, restaurants have a lot of people usually that are very close, confined environments, speaking to each other face to face, and you want to avoid that. Similarly, in a big music festival, you have a lot of people close to each other, singing, touching, commingling, and you want to avoid that. So that determines a lot of social gatherings that you will want to limit. But with these 10 measures, you should be able to control the epidemic successfully. The last question, New York. What's up with New York? What's going to happen in New York? Our best guess from a seroprevalence study that was done a few weeks ago is that around 20% of New Yorkers have had the coronavirus. That's good news, because it means that it reduces by around a third the transmission rate of the virus. It still is not enough to stop it. And a disease like the coronavirus might get up to 2/3 of people infected. And as we saw here, even if a lot of people get infected, that's not enough, because people can get infected again and again and again. Smallpox here in New York. Historically, all these outbreaks every few years happen for smallpox. So the same thing can happen with the coronavirus. So what this means for New York is we need to be very careful, because 20% of people we believe are going to be immune for the next few months, maybe years or two, but 80% are still not. So it's very possible that if we completely open up the economy again in New York, that the virus spreads again and there's another outbreak. So how do we know when we're ready to leave the hammer? Well, we can leave the hammer when we're ready to dance. And for us to be ready to dance, we need these 10 measures that I just mentioned before. Testing, contact tracing, isolations, quarantines, masks, public education, hygiene, physical distancing, and then travel restrictions and social gathering restrictions. If you do these things well, you can be relatively confident that there's not going to be other outbreaks, and you're ready to dance and you can open up. Opening up before that will be a huge gamble, because it's likely that if you have the same measures as before, you have the same results and you have another outbreak. The last question is protecting vulnerable people. How do we protect them? If the virus is spread in the population, it is very hard to isolate old people. That's what they learned the hard way in Norway, in Sweden. More than 50% of the deaths in Sweden are from people in old age residences. And that's despite the fact that a core strategy for the government was to isolate these people. So that shows how hard it is to isolate these people. The best way to protect them is to not have these running in the community anyways, because you can't really isolate these people for years. Are you going to keep 85-year-old grandma locked down for 3-4 years until there's a vaccine, or 1 year if we're lucky, locked, nobody visiting? What about workers? Are there no workers helping? Are these people also in quarantine? What about their partners, their kids? Are they also quarantined, or are they not seeing them? If they're quarantined, are the kids going to school? If they're not going to school, then what are they doing? If they are, then do we also quarantine all the families of the other kids? So in theory, it makes a lot of sense. But in practice, what it means is that you are trying to isolate these people from human contact from outside for years on end without a single infection inside of the residence. Because once you have an infection, it spreads like wildfire inside of it. So it is very unlikely that this can be done. And that's why I think the best way to protect the vulnerable is to not have the epidemic running in the community. Thank you.